Hi viewers, I am Dr. Livingston. In this video, I am going to explain about the mechanism action of DPP4 inhibitors. First of all, what are DPP4 inhibitors? They are Sitagliptins, Linagliptin, Saxagliptins, Canagliptins. Generally, they are called as gliptins. For what purpose they are using these DPP4 inhibitors? DPP4 inhibitors are used to control the diabetes mellitus. So these kind of drugs are called as novel anti-diabetic drugs. Why these drugs are called as novel anti-diabetic drugs? Because these drugs are prolong the physiological action of incretins. That means they are prolong the normal physiological action of incretins. Number two, these kind of drugs act only in the presence of food and also it acts through incretin receptor. So there is no chance for development of hypoglycemic side effect. For this reason, these drugs are called as novel anti-diabetic drugs. Then what is incretins? Incretins are localized intestinal hormone. They are released after intaking of the food. There are two kinds of incretins are there. They are GLP1 and GLP. GLP1 is called as glucagon-like peptide 1. GLP is glucose dependent insulinotropic polypeptide. So these two incretins are act on the beta cells. They are increase the insulin release and thereby lowering of elevated blood glucose level, and also it act on the alpha cell. They are inhibit the glucagon release. So this is the normal functioning of the incretin while intaking of the food. Then we have to discuss about what is DPP4. DPP4 is a dipeptidyl peptidase enzyme. It also called as adenosine deaminase complex in protein 2. They are proteins. In human, they are encoded by DPP4 gene. They are mainly found in endothelial cell surfaces. Then what is the function of DPP4 enzyme? They are inactivate the incretins. What the function is overall incretins. These enzymes are released from the endothelial cells. They are degrade or inactivate the incretins. So what is the mechanism action of DPP4? DPP4 inhibitors inhibit this DPP4 enzyme, thereby it prolong the action of incretins. Now I am going to explain about the mechanism action. The following flow chart. First of all, while taking food, after intaking of food, the food reaches in the small intestine. So immediately releasing of incretins, GLP1 and GIP. They are act on the beta cells and alpha cells. In beta cells, it decrease the elevated blood glucose level, and in alpha cell, decrease the glucagon release. Our DPP4 enzymes, it degrades the enzymes after functions. So it is inhibited by our DPP4 inhibitors. What it will do means it inhibits the enzyme DPP4 enzyme. So once inhibition of this DPP4 enzyme, the incretin actions will be prolonged. Thereby the GLP is enter into the beta cell through GLP1 receptors. Once it enter into the beta cells, it closes the potassium channel of the beta cell and it leads to depolarization, and it start to open the voltage gated calcium ions. The calcium ions are released inside the beta cells. These calcium ions are also trigger the sarcoplasmic reticulum of beta cells, and it start to release further calcium ions from the sarcoplasmic reticulum. These calcium ions contract the beta cells and release more amount of insulin in the blood. So these insulins are decrease the elevated blood glucose level. And also these drugs used to decrease the gastric emptying time. So how that means these drugs inhibit the enzyme DPP4 enzyme. So thereby it prolong the action of incretins. So GLP1 is entered into the beta cell through receptor, and it is closing of the potassium channel, opening of calcium channel, calcium ions contracting the cell, releasing of the more insulin, and it decreasing the blood glucose level. So these are all about the mechanism action of DPP4 inhibitor. Thank you for watching. Kindly subscribe.